Myth: suicide is not preventable. Fact: everyone can prevent suicide and help people in crisis get the help they need.
Myth: most suicides happen suddenly without warning. Fact: warning signs verbally or behaviorally precede most suicides. Therefore, it's important to learn and understand the warning signs associated with suicide.
Myth: people who threaten suicide are only seeking attention. Fact: all threats of suicide must be treated seriously. Do not dismiss a suicide attempt as being an attention-seeking device. The attention they get may well save their lives.
Myth: young people thinking about suicide cannot help themselves. Fact: young people may have a distorted perception of their actual life situation, problems, and the appropriate solutions for them to take. However, young people can get help with support from caring and informed people around them.
Myth: just because someone talks about suicide doesn't mean they will do it. Fact: people who talk about suicide may make an attempt to harm themselves.
Myth: the military suicide rate is higher than that of the general U.S. population. Fact: suicide rates are roughly the same for the military and the general U.S. population after controlling for age and gender.
Myth: someone who has their life together, has a job, family, and friends, is not at risk of suicide. Fact: suicidal thoughts and actions can affect people of all ages, races, genders, life experiences, and more. Even though someone's life might look picture perfect from the outside, they may be struggling on the inside.
Myth: asking someone directly about suicide will only make them angry and encourage suicide attempts. Fact: directly confronting a person about suicide lowers anxiety, increases communication, and lowers the risk of harming themselves.
Myth: if a person attempts suicide and survives, they will never make a future attempt. Fact: a suicide attempt is regarded as an indicator of further attempts. It is likely that the level of danger will increase with each further suicide attempt.
Myth: no one can help prevent a suicide. Fact: when we recognize and act upon the warning signs that may indicate someone is considering suicide, we may be able to get them the help they need and reduce or even remove the risk of suicide altogether.
Hey Warhawks, you have a resource right here on campus. It's the Counseling and Health Promotion Services. It's on the Taylor Center 3rd floor, room 316.